Chronic pancreatitis means the pancreas is inflamed over years, slowly changing how digestion and blood sugar work. The pancreas makes digestive enzymes and insulin. Over time, repeated inflammation replaces healthy tissue with scar tissue. Long-term alcohol use, smoking, genetic mutations, autoimmune disease, or a blocked pancreatic duct are the most common causes. Most people notice upper belly pain that spreads to the back, bloating, weight loss, and pale, fatty stools that are hard to flush. Doctors combine imaging like CT, MRI with MRCP, or endoscopic ultrasound with stool and blood tests to confirm the diagnosis. Treatment is built in layers. Stopping alcohol and smoking completely is the single most powerful step to slow further damage. Pain is managed step by step, from paracetamol and nerve pain medicines to procedures like a celiac plexus block for severe pain. When the pancreas makes too few enzymes, capsules called PERT are taken with meals to help digest food and absorb nutrients. As pancreatic tissue is lost, diabetes can develop. Blood sugar checks and often insulin become part of long-term care. When the pancreatic duct is blocked, endoscopy can widen it, remove stones, or drain fluid pockets, called pseudocysts. Surgery is considered when pain or complications persist. Options include drainage of the duct or removing the diseased part. A dietitian helps with small, frequent meals, moderate fat, and vitamin checks for A, D, E, K, B12, calcium, and iron. Long-term follow-up watches pain, weight, blood sugar, bone health, and the slightly raised risk of pancreatic cancer. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.